Hi, I'm Alan Benham. I'm the Executive Director at the Meadows. We envision everything through a trauma lens, and it's about how does your trauma lead to your chemical use or your behavioral issues. How does your trauma lend to that and impact it and drive that? And we like to call it that we're getting into the underlying issues. We're getting into what's really causing those behaviors.
There is sometimes a misconception that a substance abuse disorder or a process addiction is different than having depression, anxiety, perfectionist issues. Really, they're one and the same. There's an underlying issue, and that's what we look at addressing at the Meadows. What brought you in, and why are we doing the things that we're doing? Most often, that's trauma. Our childhood trauma and the things that happen to us throughout our lives that shape who we are and the things that we do. We're going to be giving you tools to help with that, and we're going to be addressing all of it. Otherwise, we're just putting on a Band-Aid. The therapists are passionate and they're excited and they care so deeply. All the things that they're asking patients to do, they do it themselves. They are masters of the information. They know some of the challenges that are going to arise. It's really a beautiful thing.
We find treatment that from 20 years ago that was pioneering and that over the years has become evidence-based and has shown to impact patients' lives and to affect change. And we have those deeply rooted and implemented into every program that we have just because it works. The tried and true trauma treatments are all baked into what we do on a day-to-day basis, and then we build on them with the newest techniques that we have. We look at every area of our treatment to try to figure out, to affect change in our patients' lives. And we say, we're going to dig in really deep to this issue and get into under what's going on. We care about patients, and it comes because we want that change to happen.